Hello, my name is Toby Capstick. I'm a consultant pharmacist for respiratory medicine at the Leeds Teaching Hospitals NHS Trust. In this presentation, I want to talk through the different inhaler devices, give you a bit of a refresher about the different features and important things you need to know about the inhalers. So we've already seen that we've got a wide range of different inhaler devices, some which are more commonly prescribed in the local area and some that you may not have come across before and some you might see very occasionally. Just a reminder again that there are good resources for going through inhaler technique videos which you can use for your own personal learning, but you can also direct people to these videos to help them refresh their memory after your consultations. And I particularly like the Asthma UK Inhaler Group videos. So just thinking about some of the practical issues of inhalers, and we've got the aerosol inhalers, we've got the dry powder inhalers. So aerosol inhalers, as we've emphasized already, we need to inhale with these slowly and steadily. You should take a full deep breath over 3 to 5 seconds. That's how long it should take you to breathe in when you use these devices. Anything faster than that, the drug's going to hit the back of the throat. They're not going to get the full dose. Remember, when you're using an aerosol, they do load vertically, so you need to use them upright, because when you activate one of the doses, it loads the next dose by a vertical drop. So if you use inhalers upside down, they will not load, so they won't fire the second dose. A lot of the aerosols contain a suspension of the drug with a propellant. Not all of them, but most of them do. So you do need to shake them to mix up the suspension. If you're not sure which inhalers you need to shake and which ones you don't need to, I would shake them all, and then you don't have to remember that. It's important that patients have got good coordination to time breathing in slowly and steadily with actuating the inhaler itself. You don't need to do that with the breath actuated aerosols like the Easy Breathe and Autohaler, but you do with MDIs and the Respimat soft mist inhaler. So you do need to have good coordination. And remember, if you're using an MDI, spacers do improve drug delivery. So particularly for people on inhaled corticosteroids and people who are using a salbutamol MDI for exacerbations, spacers will increase the efficiency of drug delivery. They're also really good for people who can't hold their breath. Dry powder inhalers, we know we have to breathe in quickly and deeply within 2 or 3 seconds to help deaggregate the clump of powder in the device to get nice fine particles that are going to get down into the lungs. Once you've opened and primed the inhaler, don't invert it and turn it upside down because the powder will just pour out. Single dose capsule inhalers like the hand inhaler and the breathehaler and Zonda. Remember, insert the capsule into the inner chamber and not into the mouthpiece. There have been case reports across the country of people choking on capsules that have been inserted into the mouthpiece by mistake. And when you pierce the capsule by pressing the button on the side of the inhaler, do just press it the once. If you press it several times, you can actually cause the capsule to shatter. And then there have been reports of people inhaling fragments of the capsule and it's not generally dangerous, but it can feel a bit uncomfortable. Reservoir dry powder inhalers like the Turbohaler and the Nexthaler, they load the dose when you prime them. They load them by a vertical drop, so keep them upright when you're priming them. And another good feature with the Nexthaler and the Genuair devices is their dose counter only counts down if the patient inhales at sufficient speed to actually deaggregate the powder. If they breathe in too slowly to deaggregate the powder, they're not going to get the dose and the dose counter won't go down. So they're actually really good as an adherence check as well. So a few little tips about individual devices. The MDI is widely available. It's also probably the most difficult inhaler to use, and generally they are compatible with lots of spacers. The air chamber FlowView Plus tends to be compatible with most MDI inhalers. In terms of dose delivery, you need to breathe in slowly and steadily, which is common for all the aerosol inhalers. So MDIs, easy of use, they are difficult to use. You do need to have a good amount of dexterity and strength to actuate the inhaler. Coordination is really important. The Haler aid I've written on this slide that it is available to help with people who've got poor dexterity, but this was discontinued at the beginning of 2021, so currently is not available. Lots of the MDIs do contain dose counters, not all of them, and some of them count down every dose, some of them count down in 5s or 10s, so just be on the lookout for that. In terms of patient feedback, patients do quite like it because they can taste it, they can feel it, they can hear the inhaler working, even though it's not the easiest device to use. The Respiratory is quite tricky to use, but it is a very efficient delivery system. So if you can use it, it's actually really effective. The new Respiratory versions are really good in that rather than locking when it's empty, they do contain a really fillable canister now, so that when you use the last dose, the clear base at the bottom just pops off, indicating to the patient to take out the old canister and put in a new canister. And you can use up to 6 canisters per inhaler, and the canister or the inhaler actually has tick boxes you can tick to say each time you put a new canister in, so you can keep track of it that way. Moving on to the single dose DPIs that contain blisters. These are the most common ones that are available at the moment. There's a reasonable range of drugs, particularly the Acahedron and the Ellipta. We've used a lot more of the Ellipta regionally, and the Acahedrons tend to be getting used less and less. To use it, the dry powder inhalers, you need to breathe in quickly and deeply. Don't turn them upside down because the powder really does pour out of these. The Ellipta particularly is a very simple device to use. It is a case of simply open, breathe in and close again. So it is fairly simple and easy to train patients. The Acahedron is very similar but has a lever to prime the device as well. The Force Spiro is a bit more complicated. They do have dose counters on these inhalers, and I do like the Ellipta dose counter because it is quite a big dose counter, so it's very easy to read, but it counts down every time you open the inhaler, so it can count down by mistake. The DPIs, the powder contains lactose as a carrier particle, so it does have a sweet taste if patients know that they've inhaled something. These are the capsule containing inhalers. You can see the Breathaler is available for a wide range of different drugs. The hand inhaler and the Zonda are just for tiotropium, and there are a couple of other generic tiotropium capsule DPIs as well. The Breathaler is a very low airflow resistance. You need to breathe in really quick to deaggregate the powder. If you breathe in too slow, it really will not deaggregate the powder. So if you only can breathe in slow, don't use this device. The hand inhaler and the Zonda have a higher airflow resistance, so actually a lot more forgiving. If you can only breathe in slowly, you will still deaggregate the powder when you use these devices. All these devices do need a good degree of dexterity to be able to open the mouthpiece, get the capsules out of blister strips, or in the case of the Zonda, out of a bottle. Because the powder is quite susceptible to moisture, they are quite thick blister strips that you need to peel back rather than push a capsule through. So you do need that dexterity. They don't have dose counters, but you can just do a simple count of the remaining capsules, so you can keep track of where you are up to it. Despite the fact that you do need a good dexterity with these, patients do like them because when you inhale through them, the capsule vibrates, you can hear that. It has a taste of the lactose carrier particles, and then often patients can actually either look through clear capsules or open up opaque capsules to see that they have inhaled the dose, to get a multiple feedback mechanism to know that they've got the dose. Reservoir DPIs, on this slide I've got a few here. Easyhaler is a really good device. It's available in a range of different drug classes. It does have a high airflow resistance, which means that if you can breathe in only fairly slowly, particularly during an exacerbation, you will still actually get a good dose, and it tends to be very effective across a wide range of inspiratory flows. You don't need to have a huge dexterity to use it. The important thing to remember is when you use an Easyhaler, you click the device before you breathe in. Don't treat it like an MDI where you click and breathe at the same time, because you won't get the dose. It has a dose counter, but does count down only steps of 10. And right at the bottom of the inhaler, it has a clear window. So if patients haven't been able to inhale the full dose, any of the dose that's still in the inhaler that hasn't been inhaled will pour out into the bottom compartment. You can see in a clear window. So it's really good to look at people and identify those people who have poor technique. Spiromax is only available for a budesonide formoterol generic, so it's a limited product range. It looks very much like an Easy Breathe, but is a dry powder version. So whilst the Easy Breathe you breathe in slow and steady, the Spiromax you have to breathe in quick and deep. The Spiromax and Turbohaler, very much the faster you breathe in, the bigger the dose you get. So the dose does tend to vary depending on how fast you can breathe in. Spiromax, you don't have to have much dexterity. It's quite easy to use. Has a dose counter that counts down in steps of 2. The Turbohaler, again, a good wide product range. You do need to have a certain amount of dexterity to be able to twist the base forwards and back again. If you've got problems with that grip, you can get what's called a turnade, which is a bit of plastic that sits on the bottom of the inhaler, makes it easier to grip, and you can get those from your local drug reps. Often the medicine in the Turbohaler has no taste, so some people can feel a bit concerned they haven't inhaled anything. So do advise patients that they might not taste anything from this inhaler, particularly if they've used any other types of inhaler device that they might be expecting a taste. A couple of other reservoir DPIs that we've talked about briefly, Genuair and Nexhaler, obviously vertical loading. They have dose counters that only count down when you inhale. The Nexhaler is a really good dose counter, counts down every dose. The Genuair only counts down in steps of 10. Really good feature with the Genuair is when it's empty, the big button right at the back of the inhaler locks in the down position. So when it's locked in that down position, you know it's empty, you need to get a new inhaler. Another really good feature with the Genuair is that it has a window right on the front. It's got a dose counter at the top and a coloured window just below that above the mouthpiece. When you click the button, the window turns green. Green means it's ready to go. When you breathe in, the dose counter goes down and that green window turns red. So you get those two different feedbacks that tell you you've actually inhaled the dose. It will also whir on you, so you can actually hear that they're inhaling the dose effectively.